And so that brings us to a little bit more information about the patient and community support work that we are able to do and have been doing during this COVID-19 response. So I want to highlight here that a major part of the focus that we have here on our community and patient work is understanding that there are people that exist with overlapping vulnerabilities, essentially making every part of their interaction with the healthcare system a little bit more challenging. And so we look at those with medical fragility often, those with chronic conditions that do not go away during disasters and therefore cannot forego any healthcare needs during disasters. And these can include groups with end-stage renal disease, those that are supported by the Kidney Community Emergency Response Program, as well as those with diabetes who need access to their insulin. And this is a group that is, again, supported by the Diabetes Disaster Response Coalition. And then that brings us to those with cancer who are supported by the Cancer Care Coalition. And the reason why we highlight these organizations is to say that there are groups out there that focus on specific patient groups. And so what we try to do is essentially coordinate across them and provide them with support to connect them with the federal partnerships that we may have, the research capacity that we may have, the direct patient connections that we make. Essentially, again, trying to make their job easier, and they support us in many ways. So it is not just a one-way street. They also are able to provide us with information to help us do our job better, so we can better understand the needs of kidney patients, for example, the needs of those with diabetes during disasters, so that the resources that we make are mindful of those different varying needs. And so that kind of covers the medical fragility that we see. Those with, again, chronic conditions that are not able to ignore their health when there are disruptions to the day-to-day schedule. And unfortunately, there are many people across the US that cannot just look at their health in isolation, but have a number of social vulnerabilities that make that all the more challenging. And essentially, what that looks like is whether it be financial access challenges, whether it be educational access challenges, lack of job security, lack of housing security, those who are homeless or in between different housing programs, those without access to healthy food, so they aren't able to always manage their health in the best way, but may have more access to fast food and corner stores versus healthy fresh vegetables that can help them regulate their health better. So with those vulnerabilities in mind, we recognize that people can't always pay attention to their health and need more information on the best ways to do this when they are navigating a range of needs that are all exacerbated during a disaster like this. And so some of the activities that we do to support people like this in these tricky situations, sharing the resources that can help them access their medication, that can help them find information on prescription assistance programs if they're having trouble paying for their medication, connecting them with resources like 211 that can also be a source of referrals to programs in their communities that are supporting them, because again, we're not fans of reinventing the wheel and creating new jobs. We are fans of creating partnerships and collaborations where they need to exist. So pointing people to the programs like 211 that can connect them with the organizations that are already doing amazing work in their community, but may just not be they may not be aware of that. We've also created new resources where they need to be created, including Map Your Meds, which is a map that we've stood up that essentially points people to all of the emergency refill and medication information that exists in their state, so they're able to just quickly plug in, look at their state, find out what resources exist, find the programs that are allowing them to get early medication refills, or insurance support for paying for medication. Essentially all the resources that exist at the state level, so they don't have to navigate different websites that they may not be familiar with, and it's all in one place. And of course, our support for patients cannot stop at creating resources and sharing information and understanding the needs that exist, but it also has to actually get to the community, of course. And so this is why we directly work with the community organizations, the advocacy organizations, the community-based groups, the churches, the NGOs, the leaders, the advocates, the activists, the people that are working on the community level and are going door to door, hopefully with their mask on, but are essentially the trusted speakers in the community that are actually able to share the information, because they may not know healthcare ready and they may not know why they need to listen to us. And that's not, necessarily a bad thing, but it is about being able to get that information to them. And so we have our healthcareready.org/COVID-19 page that allows people to access the different information that we have.